Shoulder and rotator cuff injuries are among the most common causes of upper body pain and restricted movement. Recovery requires patience, consistency, and a plan that rebuilds mobility, strength, and stability step by step. Let's walk through how to safely rehabilitate your shoulder and rotator cuff. The shoulder is the most mobile joint in the body, but that mobility comes with a trade-off: less stability. The rotator cuff, made up of 4 small muscles and their tendons, keeps the shoulder joint centered and stable during movement. When these tissues are strained or torn, even simple motions like reaching or lifting can cause pain. The first stage of rehabilitation focuses on reducing pain and inflammation. Rest and avoid overhead or heavy lifting activities that aggravate the shoulder. Gentle pendulum swings and passive range of motion exercises help keep the joint from stiffening up. Applying ice and maintaining good posture can also relieve tension. Once pain starts to ease, the next step is restoring mobility. Controlled stretches, like wall slides or external rotation with a stick, can help restore range of motion. The key is to move slowly, never forcing through pain. Breathing deeply as you stretch helps release tightness and improve movement quality. After mobility improves, it's time to rebuild strength. Start with isometric exercises, pushing gently against resistance without actual movement to activate the rotator cuff muscles safely. Then progress to light resistance band exercises such as external rotations, rows, and scapular retractions. These strengthen the small stabilizers that support the shoulder joint. As your control improves, add functional strength exercises that involve multiple muscle groups, like wall push-ups, shoulder taps, or lightweight dumbbell raises. Focus on smooth, pain-free motion and proper alignment. Strengthening the upper back, core, and scapular muscles also helps maintain shoulder stability and reduces the risk of re-injury. Balance your training with mobility and posture work. Rounded shoulders and tight chest muscles can place extra strain on the rotator cuff. Stretching the chest and reinforcing upright posture helps your shoulder move more efficiently. Consistency is key. Aim to perform gentle rehab exercises several times a week. It's better to move often with low intensity than to push hard and cause irritation. If you experience sharp pain, clicking, or weakness that doesn't improve, consult a physiotherapist. They can assess whether you need imaging, manual therapy, or guided strengthening. Finally, remember that shoulder rehabilitation is a process of rebuilding trust in your movement. Be patient with small improvements. Every degree of motion, an ounce of strength regained is progress. With time, consistent rehab, and proper form, your shoulder can return to full strength, stable, flexible, and ready for everything from daily tasks to athletic performance.